Welcome back to part 2 of the webinar. And in this part, I will review some data about health and safety incidents and talk about the structures and practices we have in place to support fellows. So parents often wish to know more about what types of incidents we are commonly dealing with. And this slide gives you some of that information over a historical trend. So last year was the 2018-19 program year, and we had 147 fellows, which was our largest group yet. And the number of incidents per fellow continued to trend down, which was great news. Gastrointestinal and flu-like illnesses continue to be among the most prevalent issues. These are very common ailments while traveling, so it isn't surprising. Our health and safety manager works every year with the country teams to remind and support fellows to make smart choices about things that directly impact their health, which are things like where and what they're eating, getting enough sleep, and other practices to stay healthy. Other medical issues included things like sore throats, urinary tract infections, migraines, rash or minor infections, and our most serious medical incident last year was appendicitis. While there are always a certain number of behavioral issues, there was only one dismissal last year, and this tied for the lowest number in the last 4 years, so that also made us very happy. So while we can't prevent fellows from getting sick or injured, we can implement intentional strategies to prevent and respond to incidents, and that's what I'd like to talk about next. So how do we reduce risk and respond to incidents? And the answer is partly through our program structure and support. So there are a number of things we do before the fellows ever leave home to prepare them for the program. And the first thing is our essential eligibility criteria. This is the touchstone for what is absolutely required to participate successfully in Global Citizen Year. And the essential eligibility criteria are communicated early to applicants and families through the website. They are used in admissions, and this is also the rubric we use if needed to assess whether a fellow can continue to successfully participate in the program due to a medical or other change while they're already in country. During pre-departure campaign, which is the summer before fellows depart, there's a number of other activities. We send out the policy handbook, which both fellows and parents are required to read and sign. And the handbook establishes the foundation for our approach to health and safety, the Global Citizen Year, behavior, values, and commitments, as well as specific policies that fellows will be expected to comply with. There are also learning modules on the policy handbook, first aid, and personal safety and healthy relationships that fellows are required to complete. Health screening is another important summer activity. We review medical forms to ensure that fellows meet essential eligibility criteria, and all fellows must get medical clearance by a medical professional in order to participate. Fellows also have to get any necessary vaccinations and travel medicine, and details about these are on the travel medical forms, which are specific to each host country. And if there's any questions about that, fellows and their families should talk to their doctors. Global Launch is another important step in preparing the fellows, and while they're here in California, we provide them with further training and orientation to help them get ready, and also give them the opportunity to meet their fellow fellows for the first time. So during the time before departure, we really stress the importance of fellows' responsibility and reliability. Because of the inherent challenges of the program, we expect fellows to be responsible and reliable partners in maintaining their own health and well-being. This is really important since our staff are not with the fellows every minute of every day, watching over them. Thus, it's crucial for fellows to complete all the pre-departure activities thoroughly, honestly, and in a timely manner so that we can ensure they're as prepared as possible to get on that airplane. Once fellows are in country, then there's a number of things that we do to support health and safety and to mitigate risk. The first are trainings. Trainings start with country launch, where important country-specific health and safety training takes place. Fellows also meet throughout the year where these topics are revisited. And there's also a chance for fellows to share experiences with each other. Supervision. Global Citizen Year is a highly independent program, but that doesn't mean that the fellows don't have some supervision and support, including regular check-ins with their team leaders. Peer fellows are also an important source of support. Partners are a very important source of support for fellows because they see them really every day, more than staff does. And partners are vetted to comply with health and safety requirements and also trained to understand the profile of the fellow and to be an additional resource beyond Global Citizen Year staff that fellows can turn to. Policies. This is where global citizen behavior values and commitments really come into force and are extremely important in providing guardrails for behavior within our community. I'm going to speak a little bit more about policies in the next section. And then finally, insurance. We provide travel medical insurance while fellows are in country, and more information on this is also available in the policy handbook and in a separate recording. So that's it for this section. In the next section, I'm going to talk a little bit more in depth about some of the policies and practices we have in place to help support fellows through a focus on some key issues.